I'm an orthopedic surgeon, and I practice general orthopedics, which has changed over the years to be mostly sports-oriented and knee and shoulder arthroscopies, but I still do general orthopedics. I've been in practice in Poughkeepsie for 30 years now. The best thing about the practice is the people that work here. We have caring people, and so it makes it a pleasure to come here. Medically, superior thing about this practice is we cover all aspects of orthopedics under one roof. So we have our colleagues and our friends that practice in a particular area of orthopedics, and we're very comfortable to talk about and refer patients back and forth. I was the third physician to join this practice. I led the practice and managed the practice for many years. We developed it from a three-man group to a multi-physician, multi-specialty group. The reason to be larger in terms of a group was to provide some vertical integration, to allow us to provide services that a smaller group or a single-man practice couldn't provide, such as radiology services, MRIs, physical therapy, nerve conduction studies, rheumatology. And we've been able to, and fortunate enough to develop those practices with a very talented group of physicians that can provide all these different avenues of care. I've always been very outdoors oriented. I'm a skier. I've skied for many years. I'm a competitive cyclist. I try to get out when weather permits several times a week, and I probably cycle 3,000 plus miles a year. I ride motorcycles, probably not the most intelligent thing in the world for an orthopedist to be doing, but I do. And I restore old motorcycles as well. Many of the patients that we see are injured athletes, either at a higher level of the competition or as weekend warriors. And to be able to speak the language, the lingo, to understand the aches and pains that they're going through, the aging process. You know, I consider myself an aging athlete, and it does bring a whole other level of complexity and achiness to participating. So the fact that I'm able to speak to these patients about that and relate it to my experience to their experiences, I find very helpful.